Hello, I'm Ben.
And I'm Oliver.
We're going to be talking about schizophrenia treatments, symptoms, and all-around awareness of the mental illness. But before we get to that, there are some broad facts on schizophrenia. Schizophrenia is a complex illness in which people have difficulties in their thought process, leading to hallucinations, delusions, disordered thinking, and unusual speech or behavior.
Schizophrenia affects around 1% of the Americans. Schizophrenia affects men and women equally. 3 out of 100 people will experience a psychotic episode at some time in their lives.
Schizophrenia affects anyone regardless of culture, race, economic status, sex, or ethnicity. Both genetics and environment play a role in whether someone develops schizophrenia. 50% of those affected by schizophrenia had occurring substance abuse or chemical dependency diagnosis. The average age of onset for males, late teens, early 20s, for females, mid-20s to early 30s. Withdrawal. Example. A teen becomes very suspicious and paranoid of intentions of others and isolates himself. Withdrawal. Example. A teen becomes very suspicious and paranoid of intentions of others and isolates himself.
Lack of emotions. Example. Teens are unable to express feelings of joy.
Ben, do you want chicken nuggets?
No. Insomnia. Example. Teens are unable to sleep during the night.
What are you doing up so late, Oliver?
I can't sleep.
Oh, bummer.
Unexplained hostility. Example. Teens are unable to concentrate.
How's studying, Ben?
I just can't focus. Lack of hygiene. Example. Teens do not brush their teeth. They wear the same dirty clothes day after day and refuse to have a shower. Ah, Oliver, you smell disgusting. Have a shower.
I don't want to shower, Mom.
Look at your socks. So gross.
They're cool. Decline in social relationships. Example. A teen may abandon strong social relationships.
Do you want to go to the movie with some friends, Ben?
Maybe another time. I'm just not feeling it today. Self-inflicted harm. Example. Teen may start hitchhiking or taking foolish risks with drugs and alcohol.
Disorganized behavior. Example. A teen is unable to think clearly.
How's the homework going?
It's really tough. It's difficult to think it through. I don't know. I just can't focus. Recoil to human contact. Example. Teens show signs of withdrawal at any sign of physical contact, either refusing to touch other people or recoiling if others reach to touch them. It may become so intense that they actually wrap their hands with paper gloves and refuse to remove them.
Oh, hey, Oliver. Sup,
Oh,
bro?
yo. Whoa. Okay, don't touch me. No.
Dude, wait. Yo, I just want to fist
Go
bump.
away. Schizophrenia can occur at any age or time in your life. Here are some symptoms you can find in children.
Language delays, late crawling, late walking, abnormal motor behaviors, rocking or arm flapping. And here are some general symptoms for almost all types of schizophrenia. Speaking without inflection, lack of tone or rhythm in speech, social withdrawal, lack of motivation, hallucinations, delusions, and poor hygiene.
I'm going to clear up some myths and facts on schizophrenia. Myth. Schizophrenia is definitely hopeless. People who have it never
While
recover.
there's no cure for schizophrenia, there are effective treatments, medications, recovery-oriented psychosocial treatments, and rehabilitation practices are increasingly helping people with schizophrenia to lead productive, successful, and independent
With schizophrenia have split or multiple personality.
Fact. Schizophrenia is not a split personality disorder. The myth of people with schizophrenia may come about because the word schizophrenia comes from Greek words that mean split mind. The split is referring to the split from reality, not a split or multiple personality.
People with schizophrenia are dangerous.
Fact. Studies indicate that people receiving treatment for schizophrenia are no more dangerous than the rest of the population. More typically, individuals with schizophrenia are withdrawn and prefer to be
Entering
alone.
further into the facts, we are now going to be talking about treatment.
The healthcare team, which may include a psychiatrist, psychologist, nurse, or social worker, will work with the person with schizophrenia and their family to help keep these goals in sight. Remove or reduce these symptoms. Prevent relapses occurring. Prevent or reduce the need to visit or stay in hospital. Avoid or reduce undesirable side effects that might result from medication. Achieve and maintain relief from symptoms so that they no longer have a negative effect on the patient's life. Begin or resume everyday activities such as work, sports, education, and independent living, and as well as social relationships.
There are different medications available to help control the symptoms of schizophrenia, but they have different advantages or drawbacks. The doctor should discuss all the important aspects of each treatment, option with the patient, and help them to make decisions about the most suitable treatment together.
Medicines used most often to treat schizophrenia are antipsychotic, such as aripiprazole, clozapine, and haloperidol.
Some ways schizophrenia can be caused.
Genetic, environmental factors. Each of these factors is thought to increase the risk of certain individuals experiencing psychotic symptoms, which may be triggered by a number of different life events and situations. Brain injury around the time of birth may be important, such as the effects of social isolation and stress, particularly around early adulthood, if they are prone to disease genetically.
Drugs without cannabis have also been associated with the triggering of schizophrenia and temporary psychotic symptoms.
Now we are going to show you some people who have suffered from schizophrenia or still are.
Edward Einstein, son of Albert Einstein. Lionel Aldridge, Super Bowl winning football player. Mary Lincoln, wife of Abraham Lincoln. We'll be talking about some of the things we learned during our interview.
This is what it's like without hallucinations. This is what it's like with hallucinations. Some of the common side effects in medicine. A sedative side effect. Drastic change in metabolism.
Meds support lifestyle.
Psychosis. Psychosis is the first stage of schizophrenia. Same symptoms. If it isn't treated, it can turn into schizophrenia.
Thanks for watching. I hope you learned something.
Voices in my head.